What are common side effects of a high-protein diet? Have you ever wondered what happens to your body when you switch to a high-protein diet? This is especially true for those following the carnivore diet, which emphasizes animal-based foods. Let's break down some common side effects you might encounter. First up, digestive issues are quite common. Many people experience constipation because this diet lacks dietary fiber, which is found only in plant foods. Fiber is essential for keeping your bowel movements regular. Without it, you may find yourself feeling uncomfortable and irregular. On the flip side, some individuals may experience diarrhea, particularly as their bodies adjust to the increased fat and protein intake. This can lead to loose stools or changes in your usual bowel habits. Another concern is nutrient deficiencies. By cutting out plant foods, you may miss out on essential vitamins and minerals like vitamin C and certain B vitamins. This can raise the risk of deficiencies that may impact your overall health. The absence of these nutrients can also reduce your body's protective mechanisms against long-term diseases, such as heart disease and diabetes. High-protein diets can also put extra stress on your kidneys and liver. When you consume a lot of protein, your kidneys have to work harder to filter out waste. This can be especially concerning for those with existing kidney issues. The liver processes the excess nitrogen from protein metabolism, which may add to the strain over time. Cardiovascular health is another area to consider. Diets high in animal protein often come with increased levels of saturated fats and cholesterol. This can raise your low-density lipoprotein, often referred to as bad cholesterol, which may elevate your risk of heart disease. Additionally, the lack of anti-inflammatory plant foods can contribute to inflammation, further impacting your heart health. You might also notice some other symptoms as your body adjusts. These can include leg cramps, bad breath, heart palpitations, and nausea. Staying hydrated and increasing your salt intake can help alleviate some of these effects. Lastly, there is a potential link between high consumption of red and processed meats and an increased risk of certain cancers, particularly colon and rectal cancers. This is often due to the combination of high meat intake and low fiber consumption. For those following the carnivore diet, many of these side effects are seen as temporary and manageable. Proper hydration, adequate fat intake, and salt consumption can help ease the transition. However, the lack of fiber and plant nutrients remains a significant concern for long-term health. If you are considering a high-protein diet, it is wise to monitor your digestive health closely and consult with healthcare professionals who understand this eating pattern. This way, you can address any adverse effects or nutrient concerns effectively.